Hello, everybody. We are delighted to have you join us for today's webinar. We'll be discussing the legislative changes to digital health policy, which are going to affect us in nursing and midwifery. My name is Jasmine Kirk. I'm a midwife and the ANMF Federal Strategic Lead in Midwifery, and I thank you for joining us. I'd like to start today by respectfully acknowledging the traditional owners of the lands where each of us are broadcasting and listening from today. Currently, I'm speaking to you from the lands of the Yagara and Turrbal people, and I recognize their continuing connection to country on lands and water that was never ceded. We pay our respects to elders past and present, and of course extend that respect to any Aboriginal or Torres Strait Islander peoples joining us today. The Australian Nursing and Midwifery Federation and the Australian Digital Health Agency have joined together again for another webinar in our digital health series, furthering the discussion about the important role that nurses and midwives play in Australia's digital health digitization. Today's 30-minute webinar will be recorded, and our entire webinar series is available at anmf.org.au, where you can also access digital health trainings, podcasts, and resources to help you become a digital health leader. Feel free to share these recordings with friends and colleagues. We're joined today by experts from the Australian Digital Health Agency. Keena Bamani and Nicola Graham are education coordinators at the ADHA. After working in sonography for over 20 years, Keena is very well versed in the impact that access to information has on the jobs of midwives and nurses. Nicola Graham has spoken to the ANMF before about the digital health capability framework for nurses and midwives. She's got management experience in both medical practice and community pharmacy, and has previously worked for a primary health network in the delivery of practice support and digital health. Together, they work on developing education resources to support healthcare providers like ourselves and consumers with awareness, registration, and the ongoing use of My Health Record. They're here to speak to you today about the impact that changes to legislation will have on the way that we access our patients' information. I'm so excited to bring their voices to you today to discuss the impact that improvements to My Health Record are already having on nursing and midwifery. At the end of today's 30-minute presentation, I'll facilitate a short Q&A. And so we invite you to type any questions that you may have throughout the presentation using the Q&A function. And after today's session, we'll send all of the live participants a quick 2-minute evaluation, and we just ask you to complete this one so that we can improve what we offer on in future. Nina, I'll leave it with you.
Thank you very much. And thank you everyone for joining us today. I hope you're as excited as we are to talk more about My Health Record and some of the improvements to the My Health Record system. But I'd like to echo the same acknowledgement to country, and I'd like to acknowledge the traditional custodians of the lands that we're meeting on today. Now, for me, that is the Gadigal people of the Eora Nation. I'd like to pay my respects to elders past and present, in the hope that we walk forward towards reconciliation with open hearts. Now, actually, before I start, I'd like to launch a couple of questions. So, Heidi, I will hand over to you to launch those first two questions, just to get a gauge of, what the pain points you have in terms of your workflow on a day-to-day basis, as well as the possibility of your interaction with the My Health Record systems. So it'd be great just to find out how often it is that you're in situations where you're looking for health information for your patient or client, and you find that information difficult to access. Does that happen often? Does it happen rarely? Does it happen always? I know that for me as a sonographer, it was something that I would deal with on a day-to-day basis, and I would say it would take up, at least an hour or an hour and a half of my day. That's at a minimum. But I'm sure for most of you, there would be similar pain points. And if any of you have I'm sure that you've heard of My Health Record, but if you haven't, obviously, um, today's session will address that. But for those of you who have interacted with the system, it'd be great to know. I'm hoping that most of you have had the opportunity to respond. Okay, fantastic. So about 38% of you have already said that you often have spent time trying to chase results. And that's so, combined in terms of sometimes, often, and always, the majority of you fall in those top three, meaning that there is a good chance that you're spending a lot of time chasing information, healthcare information for your patients. And that does take away from the time that you have to provide the clinical care that you're actually entrusted to do. In terms of you using my health record, I can see that about, more than half of you have not used my health record before, which is great, because then this particular session will hopefully give you some good reasons to actually access the system. I'll talk through Stella, who is the person that I'm hoping is, like I say, a typical or a good illustration of the type of patient or client that you would see. Now, Stella is 34 years old. You get a request form or you get some communication from her provider that basically says that she's a 34-year-old, she's had a positive pregnancy scan, and she has known endometriosis. Uh, and the other information that you get at a later point is that she does have a single fetus that's dated at 11 weeks. The GP also wants a nuchal translucency scan, and then later on, uh, she demonstrates to have placenta previa. Now, with Stella, there's a whole range of things there. Now, you would probably see her at different points throughout that pregnancy. If you are a midwife, if you're a nurse, you might see her in a different scenario. But either way, in terms of when you see her, there's a lot of information I would imagine that you would be needing. So, if we could go to the next slide, please, we can. Where my health record could come in handy is you could find out that Stella has diabetes or hypertension. Okay, so that's her medical history. You could also see where she's interacted with the health system in her Medicare claims data. You could look up her pathology reports to see her recent PAP-A and beta-HCG results. You could look up her last radiology scan because there's a good chance she has forgot to bring that with you or you don't have access to it. And you can get the measurements of the fetus at the various points that she's had those scans done. You could find out that she has an allergy to labetalol, I hope I'm saying that right, which is an antihypertensive. And you could find out that she's actually on metformin for her diabetes. This is the type of information, that key health information where my health record could come in extremely handy. So moving on to the legislation and what we're here to talk about, which is better and faster access. Why are we talking about better and faster access? And that's because earlier on this year, legislation, or at least the bill, was passed in Parliament, which basically mandates certain healthcare providers to share information with the My Health Record system. Why is that important? Well, it's going back to Stella. That's extremely important because now that it is being mandated, you have very good faith in the fact that you could go and look in Stella's My Health Record, and you would be able to see her pathology and diagnostic imaging reports. So prior to this legislation actually being tabled into Parliament, and Minister Butler stating that this is what he wanted, prior to that point, only 1 in 5 reports were actually being shared with My Health Record. And this is that I'm talking about radiology reports here. And the reason for that is that providers, up until that point, it was voluntary for them to share their reports and it was not actually legislated. This legislation is actually, if you ask me, a game changer in terms of providing healthcare to your patients because of this legislation, like I say, you can have a great deal of faith that when you look into a person's My Health Record, irrespective of where they have been, they could be traveling interstate and they see you, in those situations, it's nearly impossible to get access to their previous results. And My Health Record will now definitely have those reports available to you, at least the pathology and diagnostic imaging. Now, why am I harping on specifically about those two? Well, Minister Butler did say that he wanted this to apply to other areas as well. So other information will eventually become mandated, but he wanted to start off with pathology and diagnostic imaging, which will mean that the My Health Record system, as time moves on, will become more and more reliable in terms of a source of information where you otherwise wouldn't be able to find it. So, what is better and faster access? Because that's how it's being termed. Well, the better access is saying, well, there's going to be more information in there. Like I say, the pathology and diagnostic imaging reports. The faster access is talking about a delay that currently exists. And I'm hoping that some of you are aware of the fact that as consumers or your patients, when the report does enter their My Health record, they do have 7 calendar days before they're able to access that report. And the idea behind that is to allow the requesting practitioner that time to look at the report and then discuss it with their patient if they think that is something that they'd like to do. What the minister is proposing with faster access is to either shorten or remove that delay so that consumers have quicker access to that important healthcare information. Next slide, please. And just to let you know that these changes are not being done haphazardly, they are being done under the auspices of a clinical reference group, which we lovingly call the CRG. The clinical reference group is represented by various peak bodies and consumer groups. So they're working together to ensure that all of the changes that are looking to be implemented do have clinical risk being discussed at the heart of them. And with that, I'm going to hand over to Nikki to discuss my health record.
What is My Health Record? So I was basically saying My Health Record is a summary of a patient's key health information. It is personally controlled, and that's really important. It's a key element of the system. And what this means is that an individual has a say as to what gets uploaded, what stays in their record, and also who can see their record. Now, it's also part of a national system. Now, that means that the patient's My Health Record goes with them no matter where they go, and no matter who their healthcare provider is that is involved in their care and is registered and using the system. They can access the system. Now, that's also subject to the patient's access controls, which I'll talk a little bit about later. It's accessible at all times and it's protected by a high level of security. So, what's in My Health Record? Now, we were just talking before about the key areas, and I guess when we talk about what's available in My Health Record, we've spoken about pathology and diagnostic imaging reports, and with the new legislation, and that means that a lot more reports and diagnostic imaging reports are going to be going to a person's My Health Record. Alongside information that's available is a residential aged care transfer reason, residential care health summary, and a medication chart. And there's also the new area which is shared with My Health Record is care and support plans and My Medicare registration. Now, with pathology and diagnostic imaging, there's going to be so many more reports available in a record. So these overviews are going to be even more key in you being able to find information out about your patient's pathology reports. Now, what the overview does is it collates all of the pathology reports into one area, and it does allow you to sort through those reports by different mechanisms. So you could report by report type, date, um, even actually who the provider was that organised the report. So it does really allow you to sort through a whole range of different reports very quickly and give you that information at your fingertips when you're seeing the patient. So another way that if what say you're not registered, you can't access the person's My Health Record, you don't have a conformant clinical system. So there is a way you can access through your own clinical conformance systems if you work in a hospital system. If you've got a client with you and you can access through the hospital, or if they're having a different, depends on wherever you are, how do you access? So a person can have their own My Health Record on the My Health app. Now they're able to show and share that information with you. It's very convenient for them. And if you haven't got access to your own My Health Record, I highly recommend that you do that. And then also install the My Health app. You can take it with you no matter where you go. If you're somewhere where you're talking to a client and you would really like to find out what their pathology results were, especially if we're thinking about Stella and she's had some of those blood results, and you've not been able to see that information, you've been chasing that information and you just can't find it, then if they've got My Health on their phone, So my daughter-in-law due to have a baby very soon. She's got My Health app on her phone, and she'll be able to show and share information with her healthcare provider. So the midwife that's looking after her, and she's going through a midwife, and she feels very confident that any test that she's had is available in there for her to share with that information. So don't forget to ask your clients if they've got it on their phone, and that will give you access to information on at the time that you actually really need it. So I'll just quickly talk about privacy and security access control. Now, as I mentioned before, there is controls that's available to a person. So under the My Health Record Act of 2012, staff members authorised by healthcare organisations can access and view a patient's record, providing it's for the purpose of providing that patient with healthcare. Almost sounds like a tongue twister, sorry. Um, Now, as long as it's in accordance with any of the access controls that they've got in place. So they can put a control on their record. So that doesn't just give anyone access to their record at all. They have to just ask for a code, and that's set by the patient. They can also do a limited document access code. So that's just specific documents within their My Health record. So as you can see, they can really control their own health and care and choose who can look at that information. Slide. So in the context of the legislation with the better and faster access, one of the key areas that we really want to talk to you about is a person has control over what is uploaded or available in their My Health record, along with who can view that information. So I don't know whether you've seen there's a little box on the request forms, whether it be diagnostic imaging or pathology. And if it's ticked, it means it doesn't go to My Health record. And I guess it's really important to understand the patient can really request and choose to have that information uploaded. And for yourselves, if you would like your information shared, then make sure that box is not ticked. But that is one way that a patient can control what is in their own record. Another way they can do it is if they've forgotten at the time, when they go to the pathologist or the radiology staff, they can request that that test is not uploaded. And like I mentioned before, they can actually set a control, and they can choose who can actually access their record and view that report. They can also remove or hide that report, but they cannot edit it or change it in any way. Um, but what they can do is if they can't do it themselves, they can also call the 1-800 number that you can see on the screen here, and we will actually help them, the My Health Record team, fix that for them and help remove or hide that document. Now, it's really important to know this is a list of participating providers. Now, as we move forward with legislation, there's going to be a lot more providers that are going to be able to upload the report. But we do have a dedicated page on the website which actually shows the consumer and yourselves which pathology and radiology providers are actually registered and uploading to the system. Now is the time where we're going to go to questions. So what we'll do is we'll hand back to Jasmine. Is there any questions that's come through?
Thank you. I think the biggest question that we've had, and we've had this consistently when speaking about this, is when can we expect these changes to take effect?
So when can we expect these changes to take effect? They will be happening. I know that by February next year, as we move forward, we're going to have a lot more profile. I think the legislation actually drops or starts in February next year, and then they've got a grace period up until August where they must have their systems in place to be able to upload to the system. There's also going to be a requirement for them to be able to do this. So before, where it was just not if you didn't want to upload, you just didn't do it. They've got to actually have a clinical reason why they've not done that, and they will have to provide that. So that's going to be more people doing it, more pathology and radiology places uploading than currently there isn't. In saying that, we've had an extraordinary amount of pathology providers who have already come on board. They can already see the benefits and they're already uploading reports to a person's My Health record. So I guess when we base that question on that, if you're thinking about is there already reports available on a person's My Health record, I highly think that there will be a lot more there than you imagine there would have. There probably wasn't before, but there will be now.
Thank you. There's going to be so much more information available as a result of this change. It's just going to take such a big headache out of our days. But it's very
Yes, and we are working on it all the time. We're actively going out and talking to the pathology and radiology providers to help them get connected. So we talked before about that privacy, and and I guess that's one of the things that makes it a little more tricky for a healthcare provider organisation to register for the system, because it's not just anyone who can register. You have to be able to provide care and patient. You have to be providing patient care. Just not everyone can register for the My Health Record system and then be able to access people's information. So it's important that we go through those steps of making sure um, that they're all doing it for the right reasons. But we are actively supporting pathology and radiology practices to register for the system in time for the legislation. So when it all comes into fruition, then they will be able to meet that requirement. I mean, there will be still ones we're working with, and that's to be expected, because you've also got to have a conformance software that's able to register with the system, and so there's another part of that we're working with.
We've had a question come through, and I invite you, of course, to submit all of your questions into the Q&A for the ADHA to answer. But Annie has just asked, as a radiology nurse, she chases pathology results several times an hour, and patients often ask if insurance companies are able to access the results. She would assume that the answer is no if they select not to upload, but is there any more information that you can give us on that?
Oh, 100% I can. And it is one question that always comes up. So chasing information in your radiology practice for a patient to provide patient health and care is acceptable under the My Health Record Act. Accessing a patient's My Health Record or sharing information to a My Health Record with the purposes of insurance is not allowed under the Act, and there is severe penalties for doing that. So My Health Record is specifically for health and care. It is not for insurance purposes. Hopefully that answered your question, Annie.
I had another question. If I were to go to an interstate pathology center, say hypothetically, would my local health service then be able to see these results? Is this system going to be national?
So, so that's a really good question, Jasmine. And so I guess that's one of those key elements of the My Health Record system. So where that radiology practice sits in the different state, they will still upload that patient's radiology report to the person's My Health Record. So if it was your record, for example, and then you'll access it through My Health Record, remembering that it's a national system. You're not actually accessing that radiology report at that radiologist. You'd be accessing it through My Health Record for the purposes of providing that health care. So nationally, it doesn't matter where they go. And I guess I love that it's you can take your record with you no matter where you go, and healthcare providers. So currently, I work in North Queensland, and I'm today in Sydney with my colleague Hina. And I have a few health issues. And so if anything should happen to me, I am able to go to a healthcare provider. And most healthcare providers are actually registered with the system and would be able to see my pathology reports on my mobile app, because I do have it on my phone. And if they're registered with the system, they'd be able to access that through their their conformance system and see the information about me to provide me the care. So I don't have to keep trying to remember or provide that extra information. And I know all of you out there, at one point or another, you've asked a patient, what's that medication that you're taking? Or when did you have your last pathology report? And they go, oh, I just don't remember. Or they'll describe the little blue pill. And you really need to know the name, and you also would love to see the actual result. And that's when My Health Record is going to be very helpful for you.
Thank you. It is such a difference having the faith that no matter where I go in the country, that my care will still kind of follow with me and my records will.
Yes,
We've
so you
had
have to
another
repeat
question
the
from,
story. Yep, go on.
we've had a question from Nicola Davis. Can results from my health record be printed off specifically for gathering information for referral to multidisciplinary teams?
Yes, so you can download information. So if you're using a clinical conformance software, you are actually able to download that information into your system and you can print it. Um, and and then you can put it into your patient's clinical file for the purposes of that care, the care plan. So if they've got the app, they can share that with you. So if that's the only way you've got it, they can choose. They've got permission. They choose to show and share that with you, and they can download it and email it to you. And for the purposes of providing healthcare, 100%. And I know we're getting very close to time, and it's so great. Thank you all so much for all your questions. We do have some free online training for healthcare providers. We've got a few training resources under the nursing and midwifery. For those of you who work in an emergency department, there's actually a specific area there for education for emergency departments. There's a range of different resources in there that will show you a lot more about My Health Record and any other things that you'd like to find out about. Over
Thank
to
you
you.
so much. We do have a couple more questions, Nikki, if
Yeah.
you'd be available.
Far away.
A few more minutes. Thank you. Anonymously, we've got a submission of for those that have opted out of My Health Record and who may have changed their mind now that they understand a little bit more about how it works and they've seen the system in practice a little bit more. How can they now change their sharing permissions?
Yes. So if you opted out of My Health Record, you won't have a My Health Record. And we have found that there's been quite a number of people who didn't really understand at the time. So you're not on your own. There were quite a few people who did do that. You access through MyGov, and in MyGov you can register for a My Health Record. Or if you are having trouble with MyGov for whatever reason and you still would like to register for My Health Record, that number we gave before, that 1-800 number, you are able, it's on the screen here, Ian is telling me, you can call that My Health Record helpline and they will actually help you step through that process. So you can, and I guess that's one of those key elements of the system, you can choose to have a My Health Record or not at any time. But just remember, it starts from a point in time onwards. It's not retrospectively. So you won't have information from years and years ago. It's only from when that record is current.
I've had a colleague discuss the fact that she declined a My Health Record for her child, who was about 3. And she's now wondering if she can go back and open a My Health Record for him.
She most certainly can, yes. And through MyGov, she can do that, yes, 100%.
Right. And whether those, all of the results for his care in that time would still be on My Health Record.
So the only information that will come across is Medicare entered data, and it will go back from 2 years and then from that time onwards. But the things that you can add personally is you can add a personal health summary to your My Health Record, and you can add medications that you may be taking over the counter, any allergies that you have. But that's about it. So it's only from a point in time onwards, so you can't do it retrospectively.
Brilliant, thank you. Helen's just asked as well, the challenge seems to be that the lack of RMOs, doctors in hospital settings, knowing how to access the results. So they continue to call GP surgeries to ask for results to be sent through.
Yes.
In my experience, that's often a delightfully slow fax. Just wondering if there's anything happening in this area as well.
Yeah, so we are providing education continually through a multiple range of clinical peak organisations such as yourselves. We do work with the jurisdictions, which is our public and private hospitals, to provide education to those healthcare providers. And I guess if you're finding that you're the practice in the medical practice and you're getting that information, it might be a good idea you could also say to them, the patient may have a My Health Record. You could check there to get that information quickly. I'm happy to give it to you. So I was a practice manager before, and we did, we'd send out information to hospitals to get information like a discharge summary, for example. Whereas what we were doing is letting the GP know that actually, did you look at the patient's My Health Record? You will probably find that information there. And if it wasn't there for whatever reason, and if the doctor didn't know how to do it, we'd provide that education. But look, it's about, if you're happy, please just say to them, did you check the patient's My Health Record? And you'll help us.
I think as a midwife, I think I know who to go to when you've got questions in the clinical space. And the reason that these education sessions have been so helpful is because nurses and midwives are truly the innovators in the clinical space. And so the more information that we can get across to the rest of the team, the better things will go. Thank you so much. Thank you, Nikki and Tina, for your time. I'd really like to thank the Australian Digital Health Agency for the contribution, and thank, of course, all of our participants for giving us your attention and your time today. For all of our digital health resources, including all of our previous webinar recordings, please go to the anmf.org.au and just click on digital health. You can also, of course, search ANMF on social media to get updated on any future events. For all our participants today, you're going to be sent a short survey, just a 2-minute survey about your thoughts. And we'd love to improve what we offer in the future. So please feel free to fill that one out. Thank you so much, everybody. I hope you enjoyed the rest of your day.